Hello, everyone. Today we will answer some of the questions which we have raised in the last webinar. And also I want to throw some light on feedbacks from the effect so that it causes more effect, if you would. And again, I'm going to leave a lot of things unanswered so that we can have a discussion or you can think for yourself. I'll just recap what are the things which we have been talking earlier. One is what is a cause and effect? As we have discussed earlier, if there is two events and one event causes the next event, basically there is a cause and then is an effect. And as I have said earlier, because we live in a deterministic universe, everything has a cause and an effect. That's how the whole system works. Not just medicine, the whole system works like that. Now, in case of biology, we call that the etiology and probably the effects as disease, right? So if you are if you have some questions on that, that is the basic idea. You have an etiology that causes disease, that is the symptoms. And also to repeat, how do you determine cause and effect? This is not an exhaustive list, or this is not enough, but just the basic idea. You need to have two events and they should be correlated. There is no question about association. If you don't have an association, mostly we don't have, there is no way we can proceed after that. But even then we can, but most of the time it starts with two events which are sort of increasing or decreasing together. And then the important thing is the temporal relation. That is, one event should start, proceed before the next. That is, the cause should be earlier, and then you get the effect. Remember, all these things are not, it's not like ticking everything, because as I've already said, you can go to the bus stop and before the bus, you can go there and you may think that I came first, that's why the bus came. So that's not how it works. But most of the time, the cause should precede the event. And there should be dose dependency, that is, bigger the cause, probably the effect should also be bigger, lesser the amount of cause, probably lesser effect. Again, not always with caveats, but most of the time it is true. And then the relation between the cause and effect should have a plausibility. That is, there should be a logical way of linking these together, and they should say something, or we should have an idea or a hypothesis how these two things are interlinked. That is, if you say malaria causes, mosquito bites causes malaria, there should be a link of what is that is inside the mosquito which is causing you the malaria. Because as you remember, mosquito can lead to many diseases. How is there a different disease for that? So you need to have a plausible idea for that, or explanation. And then probably the most important thing, if you change the cause, the effect should also change, which mostly is in case of biology or in case of medicine. We do that by having an intervention study where the cause is manipulated so that the effect is also changed. And also, one of the important thing is repeatability. If you're following behavioral psychology, you will know that there are many studies which have been proven to be fake data, or all those problems with that. Mostly we found out with repeatability and also other things, but mostly repeatability was also an important factor. That is, if you couldn't do it again and again, then the relation between cause and effect is not very clear, if you would. So these are the things which we have talked about last time. And in case of physiotherapy, some of us are asking me, what is the value of understanding all these things? When you are doing an assessment, you are trying to find what are the causes which led to this condition. And also, okay, if I know that cause, can I change that cause and have a treatment kind of thing? And it's not, again, this is not a complete picture, but just a simple understanding of what it is, right? But as I told you, you need to have these questions in your mind. That is whether knowing the cause can actually have a good treatment, or always do we know whether there is a sure shot that we know the cause of the disease. Now, last time we were talking about this, so I'll just explain this. That is what the whole presentation will be today. There are wonderful correlation between structural changes in your MRI or in your X-rays, whether it is the change in the posture or alignment, or some parts coming out, some part degenerating. All these things will be correlated, mostly correlated with the disease, not necessarily the severity of the symptom, but mostly the symptoms will be there, and you will also see this in most of the patients, not always, but most of the patients. So what it means is the X-ray findings, whether it is in OA&E or in LBA or the calcaneal spur, where they will see this and they say that that is what is causing you the heel pain. So all these things are correlated very well. So the first step of our understanding of cause and relationship is complete, right? But what happens is most of the time we finish with this alone and we start moving, right? So we want to explain to some extent why that cannot be the way to move in science. The first thing you want to remember is correlation is not causation. It just means that both factors are associated to a certain extent. How they are associated, we are still not sure. For that, we need to understand a lot more factors, which I've already said about the temporal factors, the dose dependency, the repeatability, and the intervention between the cause and effect. Now, in case of MRI or X-ray, you can see that we are not seeing before. That is, there is no temporal relation. This is just a photograph which we took today. If I have a patient today, I've taken it today. So we don't have what happened 10 days before, 12 days before, or 15 days before. So there is no preceding that. We can't see that in case of clinical practice. It is never possible. That's why they all ask us to take a complete history of the patient, so that we can have a look backwards, so that we can have an understanding of what might have caused that, right? So we don't have any other way of looking backwards except for asking history. Now, in case of the X-rays and MRIs, there is no way we can go back 15 days or 20 days or 1 month and see whether the spine was proper, or whether the disc was inside or outside, whether it was herniated. All these things, it's not possible, right, in a clinical practice. But you want to ask yourself some questions. Did this complete degeneration happen in 1 day? Probably it would have taken many months. Or if you have a disc which is coming out, you want to know whether it had a traumatic beginning. That is, did the patient fall down or something like that? If they say something like that, we can have an idea, okay, did that cause this disc to come out? Did that cause to have all these symptoms? So you want to ask those things, what triggered it? But most of the time you will see that there was, if there is no prime triggering factor, you will think that this should have happened for many months or years, or the calcaneal spur did not happen in 1 day. This does not happen in 1 day. So how did it suddenly how did it suddenly causing this pain? And is that really issue? So is there a temporal relationship? You want to ask yourself that. And you also want to ask the next question, is it dose dependent? That is, the more the degeneration in ONE, does it mean that the patient will have more symptoms? Most of the time, it is not so. Most of the time, that means in the late stages, there is some amount of dose dependency, especially in ONE. The bigger the degeneration, along with symptoms of extreme restriction, extreme pain, we will have some amount of dose dependency. But most of the time, we don't have dose dependency. And out of all these things, we want to ask the important question, what is the relation? How is this degeneration causing pain? How is this herniation of the disc causing pain? And if you ask any orthopedician or a physiotherapist, they will tell you lots of ideas, the nerve is compressed, this and that. But you want to ask a next question, okay, if I give any sort of treatment, will the X-ray finding change? Then if it is not changing, how is that happening? That is, none of the causal factors are removed, but still the symptoms have gone. So you want to ask these kind of questions, especially the intervention part of it, right? So if you ask all these questions and if you have a good answer for that, you should think that they are not a causal relation. That's what we were trying to say last time. In the ONE also, you can ask some questions. Okay, if it is degeneration, why it did not happen symmetrically? Why some people have only in one leg? And also, if you do weight-bearing exercise, where if it is wear and tear, mostly we don't do weight-bearing exercise, but weight-bearing exercise is considered one of the good exercise for ONE, and it seems to have effect which can last. If you do a treatment or exercise for probably 6 to 8 weeks, you can have pain-free from anywhere from 6 months to 1 year. Increase in range, quality of life also can be changed up to 1 year. So if it is true, how is that happening? Again, you want to ask yourself this question. Now, why am I talking about all these things? Because this is what is restricting our treatment. Now, because we think that the disc will go out, we will not ask our patients to do flexion. Because we think that the knee will go into degeneration, we will not ask our patient to sit down or walk or do a lot of deflection activities. That is actually determinant to the treatment. So you want to understand this clearly. And also there are n number of idiots going around in physiotherapy, and some of them are extremely influential. So you ask your question, the bad posture caused you the back pain. You want to ask yourself what came first, the egg or the chicken? That is, because of back pain, did they go into bad posture, or did the bad posture cause back pain? Again, the trigger point is also like that, the weakness, spasticity in case of stroke or cerebral palsy. What you will see is after a stroke, all the symptoms came together. That is abnormal movement, abnormal posture, spasticity, weakness, everything came together. But we all think that spasticity is what brought it, or weakness is what brought it. Similarly, you can see that if you are, say, for example, a simple example is if you have, if there is a pain in your heel, right? Or if you are stepping on a thorn, right? The thorn pricks on your heel, and the first thing you do is you raise your heel and walk like that for quite some time, because of if it is painful when you are stepping on it. Now, if I see you later on, I may say that the abnormal posture is there. That's why you're standing like that. and without understanding the pain came earlier. So all these things are, they all came together, and we all have this nonsensical idea of rubbing the patient until the trigger point goes away. The core weakness guys are another group of people who think that weakness is the problem, but none of it makes any sense. But there is a caveat to that. We will try to understand what is the caveat to all these things. Does any of these things influence your outcome? There may be some caveat to that. We will try to talk about this next. So, okay, you have told that these are not true. So what are the things which might be true? The first thing you want to understand in biology, that is the causes might be multiple. There cannot be one cause. Say, for example, why did you get a heart attack? It cannot be one cause. It might be many causes. Or why did you get diabetes? Again, it cannot be just genetics. It can be not just eating badly, or it cannot be this and that. It should be a combination of factors. Or why did you get back pain? It should be, again, a combination of factors. That is one thing you want to remember in case of biology. Mostly it is it's multifactorial, and the effects are also varied. You will get a group of group of symptoms, and so this is the first thing you want to remember. But this alone is not enough. In case of we'll say back pain or something like that, we know that there are many factors which influence or which gets you into back pain. Again, they are multifactorial. Probably we can call them as risk factors. I'm assuming most of you know what's the difference between risk factor and causal relation. Cause and effect relation is mostly it happens all the time. The probability is very, very high. In case of risk factor, it is not very clear. That means that we don't have the exact science to say how the risk factor actually causes the disease. Is it because they are all interacting together in a more complicated manner, or whether there are hidden factors which we don't understand? All these factors are there. And you get a group of symptoms. As I've just given an example of back pain here. You get pain, range of motion. That's mostly what we are always talking about. There is, again, psychological factors like fear avoidance. That is, they don't want to move, they don't want to bend, that kind of thing. Catastrophizing, that they will think that, okay, something happened to me. I commonly hear people say that I have L4, L5 problem. Even among doctors, I have heard these people say that they have L4, L5 problem, as though they have diabetes or something like that. So they are catastrophizing in the mind that this is a big disease. And they can also have depression and anxiety. A lot of people don't go to work, they miss work, they take rest. A lot of problems in their quality of life also. I have seen a lot of people who are afraid to go to temples, which they think is very important in their life, and things like that. Now, all these things, put it in separate bubbles, but as you all know that they don't work like that. They're all so interconnected. It is difficult to take one out of the other. You cannot take pain out of ROM or fear avoidance or catastrophe. All these things are like a interconnected mesh. The easiest example you can think of is, most of us think of all our diseases or cause and effect relation like a tree, where there is a trunk, there is a root, and then there is a trunk. So if I pull the root out, the whole thing will go away. But our diseases are like creepers. There are lots of like your creepers which creeps on the floor, where there are roots in different places. They are so networked. If I have to pull it, I have to pull it in different direction. If I pull one, there will be other thing which is moving. So all these things are so interconnected. It is absolutely poor idea to think of it as separate ideas, but just for our understanding, we have to think like that. But in case of biology, what happens is we have a lot of feedback loops which goes from here to here. That is, they give a negative feedback towards the causal factor. Then they come back again and makes it worse. That is, if I have pain and ROM, and if I am having a certain amount of pain, and that will go here, and that will probably increase my fear avoidance. That fear avoidance will go back. That will come back as more pain and ROM. That kind of complicated mesh happens, and this negative feedbacks. They also have positive feedbacks. If you reduce, say, for example, fear avoidance, you will have the whole thing will also reduce. So these feedbacks is what we usually don't learn in our medicine. And that's why they have a lot of these courses on, there are two muscles which are weak. So if you remove that, all these things will get over. These things are not that simple. They are far more complicated. That's why also, if you don't know what is the causal factor very clearly, if you reduce some of these things, they give a negative feedback and the whole thing reduces. If you remove some of these parts of it, there is a huge change in here. So the differentiation between cause and effect becomes slightly like a continuum, which is a blurring of where the cause starts and where the effect starts, rather than just a simple idea. So the last point I want to say that we don't have much of idea of what causes many painful conditions, and don't worry about that because we have a better idea of how to treat them. So what does it mean if you think that there are negative loopbacks, loops, and then there is also a clear-cut understanding of what is cause and effect. For that, I'll just give you some points where you can think about them. I'm not going to give you clear-cut answers, and if possible, we will discuss, or you can think for yourself. As I told you, the first thing you want to remember is many conditions we don't know the cause, but we can have a good treatment, which ranges from diabetes to ONE and many what we call as ordinary fever. We just don't need to do anything. We just have to give some medicine to feel comfortable, not the antibiotics, but the NSAID and things like that. That is it. It goes away by itself. Sometimes you have a good treatment which reduces the effect, which in turn causes the cost to get reduced. And so the negative loopback works, and it goes very well. And the other point I want to make you all think for yourself is, we know that there are a lot of areas in the brain, but if I ask you what is the language area, you will definitely show here the vernix area. This region probably for theory of mind and some amount of face recognition, all these things. Here you can show that here it is about executive function. And if I ask you about the limbic system, amygdala, you can say that this is because of the fear. This area activates the fear response. Probably the cingulate cortex can be about the reward system, or a lot of things are we know. We want to ask ourselves, how did we know the cause and effect? Basically, this is the cause. This is the area which is causing it, and the effect is what you feel or what you do. How did we know that? How did we go into the brain and study that? Some of it, as we already know, that it is clearer by having injury to the brain, you can see that if that region is not there, so the function is not happening. Remember, that is also a correlation, that is not a causal relation. So how did they find out all about these things? So there are many steps to finding about these things. Again, I would impress upon you to go and understand about how they found all those things. Because of two things. One is you can make us understand how the brain works so that we will not make mistakes, or we will not overestimate ourselves about how the brain works. So to summarize, as I have given you somewhat iffy picture of understanding cause and effect, I'll try to make it slightly robust for us to understand or how to learn about these things. The first thing I would suggest you to is to look for multiple factors. The multiple factors can be causal factors as well as risk factors. Remember, in case of back pain, there are many risk factors. We don't know the causal factors. The risk factors can be probably sitting for a long time. We are not active enough, probably not sleeping enough. So these things can be risk factor, not causal factor, but these are all multiple factors. Why we want to know all those things? We want to intervene at all the factors, not just one factor. If you are fixated on one factor like the disc or the posture or two muscles or the weakness, then you are not having a proper understanding of the disease and your treatment is not rounded up. So always look for multiple factors. Look for complex interaction. As I told you, the interactions between the environment, the person, and the disease is far more complicated. And you want to understand the complex web of interaction so that you can have a better understanding of the treatment and a better intervention. Seek plausibility. Always think of the last time we were showing a video of a person pushing a train and thinking that he only started the train. As we know that that cannot be possible. But in case of physiotherapy, if I tell them that if I do this, right? If I do this, then my bones are going back to the alignment. If I do this, then the disc is going inside. Everybody is like, what a beautiful idea, right? So if you want to have a far better understanding of these things, think about whether this is plausible. Is it possible to have that kind of treatment? Will it not come back? If, say, for example, you give a traction and you're pulling it, even if you assume that Newton is wrong and you have pulled it apart, what happens if he stands up, and will it not go back to its original? So think about those things. And for that, one of the reasons why we don't think like that is because we don't understand where this knowledge came from. Who told? Why are we okay with somebody telling us and all clapping ourselves? Especially if a white person comes and tells us, or a person with 2-day workshop comes and tells us, we are all, oh my God, seems to be true. So try to understand, where did they get this idea? What is the research behind this? What is the science behind it? Is this coming out of their hat, or is it actually truth? So try to find the epistemology of all these things. Out of all these things, the most important thing is, after understanding all these things, we want to have an intervention which encompasses these ideas and leads to better recovery. If it leads to better recovery, then we have a proper clinical practice. We are helping human beings. Otherwise, even if we know all these things, the science is not complete. The science gets completed only when evidence shows that, okay, it's multiple factors. I have intervened in multiple levels. The interaction is complicated, so I have also taken that into consideration. I have a good hypothesis of how this works. Then I have to show it in a clinical trial where this actually works. So if I do that, then my whole understanding of cause and effect is okay, I will say it is complete, right? If it is not so, then it is actually of no value. So that's how most of our things have been discarded. Say, for example, the uselessness of X-rays, the uselessness of uh, uh, rubbing somebody for reducing the pain, or uselessness of just doing core exercise or this exercise, that exercise, right? So that's about it. As I told you, if you want to understand the correlation, I mean, cause and effect relation, I think the first question or the first thing we want to ask to tell to ourselves is, I don't have a slightest clue what is the cause and effect relation, and then take a step and trying to find out. If I'm unable to find out, just say I don't know. As I said to some of the people who asked me last time uh, via WhatsApp, uh, I don't have the slightest clue why I get a headache, but I know how to manage a headache. Likewise, I don't have the slightest clue why I get ONE or LBA, but I know how to manage that. That's what my patient wants, and I'm happy with that at this point of time. For that, I need to tell myself that I don't know. Thank you so much for listening. If you have any questions, this is the time to ask.